something that is with us that we are managing.
It's getting to the malaria level.
It's getting to the thank you. Something like that, if you want to coin it that way. Yes. So you know what to do to stay protected. Keep some distance. Ask questions. Find out whether there's anything that would trigger in your mind that this may be an potential infectious disease, Lassa, Ebola, whatever, COVID, and manage that way. And then we have also been taught to refer. So if something is more than what you can handle, for example, there are doctors who are infectious disease experts. I'm one of them.
Okay.
So we are. There's a protocol that these are their numbers to call once you have a suspicion that this may be a viral hemorrhagic fever. Call these numbers so that you can come and get that additional support of people who have maybe a bit more expertise than you have, and then they can be moved to care. And actually speaking, I don't want to sound controversial because I know that story very well. That wasn't true.
I wasn't going to necessarily go into the story.
So I just wanted to mention and dismiss that it wasn't true.
It wasn't true, really?
It wasn't true. Not at all.
So there were doctors on ground?
Oh, yes. He was in the best part of the place in the hospital that you see the best care. I mean, if you know the intensive care unit.
I've never been there, but I've heard of it.
You've heard. The intensive care unit is where you have all the gadgetry and you have all the... So, I mean, and he's a colleague, for Christ's sake. Why won't he be attended to?
So, I was going to ask, when you talked about protective gear, I was going to ask if we have enough protective gear. Because during COVID-19, one of the songs that we sang was that there were not enough. I mean, I'm not talking on behalf of the workers now, the health workers. We have enough.
So coming from, generally speaking, we have adequate supplies. Probably the challenge will be the distribution of those supplies to make sure that it gets to everybody who needs. But it's not like when we had COVID where we had acute shortages. We now have the gloves, the gowns, the masks. They are there. Even the hand sanitizers. Yes, so use them. And I usually tell health workers that you come to a place and those things are not provided. The time limit between when you are waiting for those things to come, you make a request, you're waiting for those things to come, go and buy and put in your pocket and use. It sounds like, why? Because your responsibility number one is to be alive. Okay. While you're caring for your patients. Yes.
Are there misconceptions about Lassa fever?
A lot of misconceptions.
Because when I saw that tweet, I had to ask my colleague who reached out to you, I didn't because when I'm like, why is this happening? What's really is happening? Because we didn't really have enough information as to what was happening. So what are some of those misconceptions, that when you say Lassa fever, we have in our public space? Okay,
so I actually mentioned some of them off and on, but let's detail. Number one is that it is so deadly that if you even look at someone that has Lassa fever, you just die. So people are just scared. Fear is it's good, that fight or flight response, that adrenaline pumping response, but it actually makes people do silly things. Okay. So even among healthcare workers, there's a tendency to be afraid. Oh, Lassa, there was one person with Lassa, everybody just wants to take off. But we've trained ourselves and we've drilled ourselves that you can provide care while staying protected. So we've just said that Lassa fever doesn't kill everybody that gets infected. In fact, 9 out of 10 cases will probably go unscathed. It is one that will probably die. But because you don't know which one it is, you just have to be careful. So that's misconception number one. Lassa fever cannot be gotten by shaking, by hugging, by being in the same car, by being in the same vehicle. It cannot. The second misconception is that it cannot be treated. Okay. And it cannot be helped. We actually have, unlike Ebola, with Lassa, we have a drug that has been shown to have some effectiveness.
There's a drug?
Yes, there's a drug that has been shown to have some effectiveness against Lassa. And we can actually give that drug even once there's an exposure, even before an illness starts. So post-exposure, we can give that drug and it can actually help to prevent the occurrence of that infection. All right. Two major misconceptions.
All right. And those you're done with misconceptions?
We can take, maybe if you have
all right. Now this one to say, can someone get the virus by eating rats? Because my brothers from a certain state are fond, I think he meant to say, are fond of eating rat, coming from Dave.
Very, very correct. Because if you're talking about urine and the excreta of rats contaminating food and you can get it, then if you eat the rat itself, of course you will get it.
But you will still cook the rat now.
Yeah. So many people, it is not in the cooking that is the issue. It is in the handling,
it is in the
cutting,
handling,
the arranging, the washing,
the blood and
all of that. That is the challenge, the preparation.
Interesting. This one says, also, can a symptomatic patient transmit the virus to another one? It said, okay, started by saying, good evening, Prof. Can Lassa fever, why do you guys call it laser fever? Lassa fever patient be asymptomatic and recover without treatment?
True.
Okay.
Very correct.
So many of us may have had it. We don't know.
You don't even know.
All right. And then he said, can it be transmitted to another person if it's asymptomatic? Remember during COVID, we said it's not possible.
Yeah. So with viral hemorrhagic fevers, transmission usually occurs at about the time when fever kicks in. So fever is what triggers you to say, okay, this person may be transmitted. Yeah. So somebody who doesn't have any symptoms at all, very, very unlikely to be able to infect another person.
This one says, you said, Prof, we should not drink or sip Gary. That one is hard though, because swallow Gary or Eba is very difficult for me. Please, what is the way forward?
Abstain for a few months. You will survive.
You will survive.
You'll survive.
Now, is it not the right time for the health ministry to mount surveillance and construct an epidemiologic? Help me there.
Epidemiological.
Okay, thank you. Paradigm to contain the transmission, since most of these VHF have the same route of entry. From my own observation, this is clearly a pandemic, and if not handled properly, might result into an epidemic. However, what program have been mapped out in terms of designing maybe a subunit vaccine or a live
attenuated
vaccine to that? I mean, this doctors. I know this guy is a doctor, Kingsley from University of Nigeria, Nsukka. Do you have an answer for it?
I'm not sure if Kingsley is a doctor. Anyway, so but maybe somebody in the health space.
Okay.
Plenty of things he said here. Now, there is a structure.
Okay.
There's the River State Public Health Emergency Operations Center. Mm-hmm. Domiciled in the Ministry of Health, with collaboration from across the state, public, private. I'm a member of that body.
All right.
And so our responsibility is to have that surveillance and to be able to quickly preempt and act to control. So that is why you could hear the Commissioner for Health saying, we had this, we identified it, we resolved it, and we are okay with that particular one, while we are watching out if there's any other one that could occur. So that structure is firmly in place. What we need is more education for healthcare workers and for the general population. Now that's part of why I'm here, talking to people and telling them what they need to do to stay safe, because safety is a personal responsibility, then it's a collective responsibility. Then about vaccine, it's a very good question, because Lassa Fever vaccine, the vaccine against Lassa Fever virus would have been fantastic, but it's not there yet. And how many years we've had Lassa with us? It's not. Nigeria we need to wake up to our responsibility that we can develop vaccines. What happens is that if it is something that affects a certain category of people, there's a push to develop
what do you mean
vaccine.
What do you mean by a certain category? No, this is hard facts. No, that's what we're saying. This is hard facts.
So for example, when it was with COVID, that was affecting people in the not just sub-Saharan Africa. Now it was affecting people in the UK, in the US, in Europe, in the Western world, in the so-called developed countries. There was a strong push to develop vaccine, and they fast-tracked that process. Lassa fever is an orphan's disease, for example. What I mean by that is, it's not those people in sub-Saharan Africa. It's not West African people. They are suffering it. If enough people in Europe, but it's not entirely their fault, because we have to wake up to the responsibility that if we have a problem, we have the expertise and the intelligence to be able to develop vaccines. What we need is the support for research and development, testing, and all of that to be able to do that.
So, what is the challenge when you say research and development?
Is funding researchers to develop vaccine solutions. Simple. And having that enabling environment and structure where people can just get into the lab and just test things. All right, and that follow through to go through the different levels of testing out whether a vaccine works or not.
All right. Okay. I would take your calls now. I'm sorry, I usually get carried away with the conversation here. This one says, good day. The Ministry of Health and Urban Development should help in cleaning the drainages You say that is the major cause of rat infections, Ugo Sunday. Could it also be that, the indiscriminate way of disposing refuse? Because that's one of the reasons why I even wanted to have this conversation. You step out and people are throwing dirt on the road indiscriminately without recourse to the environment. Could that also be a major attraction for these rats, these multi-breasted rats?
So it's unfortunate that people will abuse their environment, and then come and call Ministry of Health or Ministry of Urban Development. What is urban development? What are they going to come and do? Clean your environment and stop dumping refuse indiscriminately. I know people who channel wastewater into their gutters in their environment. I know people who just wind down your car. Somebody will just fling something in the middle of the road and it lands anywhere it lands. We should stop it. So what we should be calling for is cleanliness, environmental sanitation, cleaning. Everybody be a watch person over the other people. Somebody drop something, my brother, sister, pick it up. And then we should have, proper. So you cannot say government. How do you manage? So we're dropping refuse at particular designated spots. Are you coming to pick it up? Are you clearing? So government shouldn't come and clear your gutter for you. You are there, clear your gutter.
Let's go back to prevention. Sorry.
Yes, please.
You are in the infectious disease. How do I put it now? Specialty in the health
public
sector.
Health epidemiology specialty in the health sector.
Okay.
Yes.
All right. So now the question is, could you work with? Is there that relationship with other sectors like the environmental health to prevent? Now, why I'm asking is this. Now, you mentioned some people dispose their sewage into the gutter. Some people, dump refuse in front of people's houses, or people, once they see that the land is vacant, they just throw the dustbin into. Do you think those people should be charged and fined heavily to be a deterrent to as many other people who would want to do it? Because I do feel, instead of us crowding our health centers with people coming for treatment, we could also stop it from happening, with all of these strategies and actions taken.
So I'm here nodding my head vigorously because you're just spot on. You're just right on the money. We have environmental health and we have a lot of collaboration. Public health has collaboration with veterinary medicine, with environmental health, with social welfare, and all of that. So we have all those systems and those networks are there. The environmental health officers, interestingly, are backed by a law. They can charge someone to court, they can fine someone, they can provide what they call an abatement notice and give you a short period of time to clear that thing that you have used to pollute the environment. They're empowered to do so. What can we do to help them do their job better? Provide the logistics for them to be able to go to these places and provide them with the funds to be able to do their jobs properly. And then when those people are charged to court, let them pay the fines and pay the penalties. Send some people to prison. Let them stay there for a few days. Yes. Yes, you have to put in deterrent so people to know that they can't continue behaving like this.
All right. Now I will have to go to the phone lines. Now this time I'm serious. I'm sorry. 0817 923 0002 and 0817 923 0003. I also have the number 0817 923 0007. Do you have questions? I like to hear them. But my question to you is, what are some of those challenges? What are some of those difficulties that hinder the prevention? I'm not talking about the treatment now. We've heard about the treatment. We hear there is a drug for it. We hear that sometimes it is asymptomatic and you could recover from it. It's not necessarily a death sentence. We've heard that as well. But what are those things? I mean, your area, is it rat infested? Why do you think it is rat infested? Let's start from there. And what are the challenges to exterminating, the rats in your area? I know they say thou shalt not kill, but it's very important now because it's causing Lassa Fever. You can give it to the next person. So this is public health. I'll take this call now. 92.3.
Hello.
Yes. Good afternoon. Welcome. What is on your mind? I'd like to hear. First of all, your name and your location.
Good evening, sir.
What's your name, please?
My name is Casey.
All right, Casey. Welcome.
Sir, I listen to your program. It's very, very interesting.
All
God
right.
bless you people.
All right.
Sir, I want to ask, if Lassa fever is such that will kill, what of people eating rats?
I thought we touched on that.
That is number one question.
Mm.
Then number two, we are talking about environmental sanitation and every other thing environmentally. If you come to, I don't know, I was targeting where I will get this opportunity to talk about people living at Omagwa, more especially those people cooking, doing this bushmeat of a thing. If you come to the main road, they are dumping, they are pouring even the bushmeat entire standard in such a way that you cannot be able to pass. Even when you are passing with maybe a leg or something, a car or a motorcycle will flash all the dirty along the road. You come to along the road inside the gutter, they are dumping all those intestine, black and green, everything all around. So how can the environmental sanitation take care of this?
All right.
So that is the question. Thank you.
All right, Doc.
Okay, so I think you were saying we had touched on it. Can it cause people to die? Yes, it can, but it's not true that everybody who gets infected with Lassa fever will die.
Okay.
9 out of 10 people would not. Probably just have 10% of the people who get infected with Lassa fever that it may become very serious illness. Then about the environmental health authorities, we've also talked a bit about that. I think this should just be a call pointing out that particular situation and asking the authorities in the local government area in that area to just go check that out.
All right. So we have another call coming in, but Ugo Sunday sent in another message. Said when he was we lost the call. So when he was growing up, I believe he's a guy. When he was growing up in the 80s, the Ministry of Urban Development usually would clean drainages. Is that department in the ministry, or is that department not in the ministry? Again, Ugo Sunday is asking. But we're out of time. Yes, it's not your sector, so you would not answer. What is your final statement, please?
Okay, so while we are in the Lassa season, December to about March every year, let's just be very careful and keep safe. Avoid anything that will put you in contact with rats directly, or their blood or their feces or their your urine contaminating the environment or your food. Also avoid caring directly for somebody who has fever or who is very ill without personal protective equipment. And let's keep our environment clean and make sure that we de-rat our homes and keep our environment.
All right, thank you very much. I do really appreciate Professor Maduka, Professor of Public Health, and it's been a fun. I see. After talking for almost an hour, you seem exhausted. You came in with so much energy, and you're sounding like you're tired already.
It's good. It's a good tiredness.
All right. Thank you for educating us. Thank you for all of the pieces of information, and I do really appreciate it.
Thank you. Thank you for having me.